Everyone, this is Dr. Mansuran Rao and the program I teach medical students. Today in my class, I'll touch briefly on brainstem. Brainstem is a very important structure that connects the cerebellum with the cerebellum and the spinal cord. Well, it is divided into midbrain, pons, and medulla. It contains the most important structures like the cranial nerve nuclei, except the first and second and the spinal accessory. And it is through this structure the motor tracts and the long sensory tracts, they run from the spinal cord to the center, from the center to the spinal cord. It's very important to know the anatomy of the brainstem in order to localize the lesion. Brainstem as such is the most primitive part of the brain. Rostrally connects to the diencephalon and caudally connects to the spinal cord. So this is the structure in between the cerebrum and the spinal cord. Contains all the cranial nerves, as I told you, nuclei of the, except the nuclei of the cranial nerve 1 and cranial nerve 2 and spinal accessory. It has got the connections with the cerebrum, basal ganglia, cerebellum and spinal cord. Well, ischemic lesions secondary to the occlusion of the blood vessels supplying this part of the brain, space-occupying lesions, and the infections, etc., affect the brainstem functions. Consists of midbrain, that is mesencephalon, pons, that is metencephalon, and medulla, that is myelencephalon. The functions includes, it controls the functions of the central nervous system. It controls breathing. It controls your heartbeat. Well, coming to its development starts around 4th week of gestation. Rostrally, it has got 3 vesicles that it develops into the ventricles, two lateral ventricles, and central third ventricle. That is forebrain is prosencephalon, midbrain is mesencephalon, hindbrain is the rhodencephalon. Prosencephalon develops into telencephalon, which in turn gives rise to 2 cerebral hemispheres. Mesencephalon remains at the midbrain. Rhodencephalon into the metencephalon and the myelencephalon. That is pons and the medulla. So this picture shows you the development and various segments of the development of the brainstem. This is the prosencephalon, this is the mesencephalon, and this is the rhodencephalon. Prosencephalon gives rise to telencephalon and the diencephalon, which in turn develop into the cerebral hemispheres and the thalamus and other central part of the inner structures of the cerebrum. And mesencephalon develops into midbrain. Rhodencephalon gives rise to metencephalon, which develops into pons. Myelencephalon gives rise to medulla. This is briefly the terminology that is used in terms of development of this forebrain, that is rostral part of the neural tube. Then coming to the brainstem, it comprises of midbrain, pons, and medulla. Midbrain is the structure that connects the pons and cerebellum with the forebrain. Well, it consists dorsal tectum and the ventral tegmentum. The aqueduct of sylvius passes through this structure connecting the third ventricle with the fourth ventricle. Well, there is periaqueductal gray matter that surrounds the aqueduct. Ventral portion contains the cerebral peduncles, that is corpus cerebri, the pyramidal fibers, corticopontine and the corticobulbar fibers pass through this structure. That is, cerebral peduncle is the connecting part from the midbrain and the cerebrum. Okay, the fibers, that is pyramidal fibers, corticopontine fibers, corticobulbar fibers, pass from the cerebrum into the midbrain. These are the cross sections of the pons, that is midbrain, pons, and the medulla. This is the midbrain, this is the pons, and this is the medulla. It has got this is the dorsal part, this is the ventral part. This is the aqueduct or sylvius, periaqueductal gray matter. We look into this. This is the MRI image. This is the midbrain. That is the most rostral part of the brainstem. It has got this is the dorsal part, and this is the ventral. Dorsally, there is superior colliculus, there is the central canal, there is a periaqueductal, there is a aqueductal sylvius and a periaqueductal gray matter. Here you have got the oculomotor nucleus at the superior collicular level. You have got the red nucleus down below, and ultimately ventrally you have got the cerebral peduncles. Well, midbrain has got the tectum, that is dorsal part, which contains the superior colliculus and the inferior colliculus. Then ventral to this, there is tegmentum, that is the middle portion, contain the nuclei of the oculomotor and the trochlear nerves. Little laterally you have the substantia nigra and the red nucleus. You have all the long tracts, that is medial longitudinal fasciculus that run from the spinal cord to the brain. Medial lemniscus. It also contains the afferent tracts and lateral lemniscus, spinothalamic, and rubro-olivary. These tracts, they run into the tegmentum. Coming to the blood supply, it is supplied by two vertebral arteries which originate from the subclavian arteries, enter the vertebral canal at the sixth cervical vertebra. After entering the cranium through the foramen magnum, they course along the ventral surface of the medulla and join together at the pontomedullary junction to form the basilar artery. So these vertebral arteries give away the branches to supply the spinal cord, medulla, and the cerebellum. Well, coming to the basilar artery. Basilar artery is formed by joining the two vertebral arteries at the lower margin of the pons. It runs in the ventral surface of the pons at its center and ultimately ends as the two posterior cerebral arteries at the upper border of the pons. Well, it gives away branches to supply the inner ear, the pons, cerebellum, okay, and occlusion of these arteries will result in various syndromes. One is Weber's syndrome, another is the Benediks syndrome. Weber's syndrome is the result of occlusion of paramedian branches of the basilar artery. and also some branches of the posterior cerebral artery. It results in an infarction of the cerebral peduncle and the superior colliculus. This results in the ipsilateral oculomotor nerve palsy with contralateral spastic hemiparesis. Okay, the lesion of the Weber syndrome has got only two components, that is ipsilateral oculomotor nerve palsy with contralateral hemiparesis. Okay, rest of the structures are spared. Whereas Benediks syndrome is the result of occlusion of the penetrating branches of the posterior cerebral artery. So, the infarction results in the damage to the third nerve fibers and the red nucleus. It presents as ipsilateral third nerve palsy and contralateral hemiataxia and incoordination and chorea. This is the Benediks syndrome. You look at this particular structure, which is very important. This is the cross section of the midbrain. You have got the dorsal part here, and this is the ventral part. Well, you have got the aqueductus cilius, periaqueductal gray matter. These are the superior colliculi. Well, so this is the tectum. The tegmentum contains the nuclei of the cranial nerves. That is the third and fourth cranial nerve. They are there in the midbrain. Third cranial nerve nucleus is located at the level of superior colliculus. Fourth cranial nerve nucleus is located at the level of inferior colliculus. Here in this part of the structure, we don't find trochlear nerve nucleus. It has got a third nerve nucleus because it is at the level of the superior colliculus. Then more ventromedially is the red nucleus. Then little further inferior lateral is the substantia nigra. Little more ventrolaterally is the crus cerebri or cerebral peduncle, through which corticopontine, corticobulbar fibers and corticospinal fibers, all these motor tracts, they run in the crus cerebri to reach the rest of the brainstem and ultimately run in the pons and medulla and reach the spinal cord. So laterally we see the sensory nerve nuclei and their tracks. Well, look at the next slide. This is the diagrammatic representation of the medial midbrain syndrome. It involves the associated with the infarction of the crus cerebri and the fibers of the oculomotor nerve, resulting in the contralateral spastic hemiplegia, ipsilateral oculomotor nerve palsy. This is the lesion, medial midbrain syndrome, almost same as the Weber syndrome. This is the oculomotor nerve nucleus, and this is the cerebral peduncle containing the descending fibers, corticobulbar fibers or the corticospinal fibers. Then the lesion here results in the contralateral spastic hemiplegia and ipsilateral third nerve paralysis. This is a little extended lesion representing the Benediks syndrome, in which the fibers of the third nerve and the red nucleus along with the pyramidal fibers are affected. So results in the ipsilateral third nerve palsy with contralateral hemichorea, hemiparesis, and the incoordination and involuntary movements. Well, this concludes the talk on midbrain, its development, its structure, and various lesions resulting in the syndromes. That is Benediks and the Weber syndrome. Thank you very much for patient listening. We'll meet again in the next class. Until that time, bye-bye.